What I'm about to tell you is going to make you rethink that harmless bedtime drink you've been having for years, because for some people, it's not harmless at all. I'm Dr. Sandra Whitmore, and tonight we're going to talk about the 3 drinks you should never have before bed if you're trying to avoid high blood pressure or get it under control, even with medication. And I'm going to be blunt. One of these drinks is hiding in plain sight in the healthy aisle. People drink it specifically to relax. And it can still drive blood pressure up in a very real, very biochemical way. Stay with me, because I'm saving that one for last, and it surprises almost everyone. Before we dive in, subscribe to the channel for clear, doctor-led tips that protect your heart, sleep, and life tonight. Let me tell you about a patient I'll call Dennis. He was 71, organized, careful, did everything right. He walked daily, took his meds, didn't salt his food. But his morning readings were creeping up, 142, 148, 151 systolic. And it was starting to scare him. So he did what most good people do. He started trying to relax more at night. He created a bedtime ritual: soft lighting, quiet TV, a warm drink, and then bed. And the night he started the ritual, he slept faster. But his pressure started rising. That's the trap. Better sleep onset doesn't always mean healthier sleep physiology. So tonight, I'm going to give you a simple framework. 3 drinks, 3 mechanisms, 3 fixes, and 1 fast test you can do to prove to yourself whether a drink is affecting your blood pressure. We'll go from the most common, everyone already suspects it, drink to the one that gets a free pass because it looks natural and soothing. And as we go, I want you to think like a detective, not a perfectionist, not someone trying to be good, a detective. Because the goal is not guilt. The goal is control. Drink number 3, the I can still sleep caffeine. Drink. The first drink to avoid before bed, drink number 3, is anything with caffeine, especially when you tell yourself, caffeine doesn't affect me. And I'm not just talking about coffee. I'm talking about iced tea, green tea, energy drinks, pre-workout powders mixed into water, colas, chocolate drinks, and yes, even that small espresso after dinner. Caffeine is sneaky because it doesn't always feel like anxiety. For many people, it feels like focus, or comfort, or just routine. Here's the story. A woman I'll call Elaine, 68, told me she had a nightly tradition. She'd clean the kitchen, sit down, and sip a tall glass of iced tea while watching a show. Because it's not coffee. She'd fall asleep fine. That's what fooled her. But she'd wake up at 3 a.m. like clockwork. Heart slightly racing, mind alert, and then she'd drift in and out until morning. Her morning blood pressure looked like it belonged to a different person. And when we took caffeine out of the evening, same dinner, same show, same chair, her nights smoothed out and her pressure started dipping again. Let me explain what caffeine is doing in plain language. Caffeine blocks a chemical in your brain called adenosine, which is one of the big sleep pressure signals. When adenosine is doing its job, your body gets the message: slow down, rest, repair. When caffeine blocks that message, your nervous system stays slightly more on. And when your nervous system is on, your blood vessels tend to tighten instead of soften. Your heart may beat a little faster. Stress hormones can rise, not always dramatically, but enough to move blood pressure for certain people, especially if you already have hypertension or you're sensitive. Now, here's the part most people miss. Caffeine can disrupt sleep even when you don't feel it. You can fall asleep, but your sleep can become lighter and more fragmented, meaning your body doesn't spend as much time in the deeper stages where the nervous system truly downshifts. And if your sleep is lighter, your body acts like it needs to stay ready. Ready for what? Nothing. But it doesn't know that. So the nighttime dip becomes smaller. You wake up with higher numbers, and then you think the morning is the problem, when really the night was the problem. And I want to be specific about timing because this is where people get tricked. They'll say, but I had caffeine at 4 or 5 p.m. That's not bedtime. The issue is that caffeine can hang around. Some people clear it quickly, others clear it slowly. Age can slow clearance, certain medications can slow clearance, and genetics can slow clearance. So if you're the kind of person who can drink caffeine at 5 p.m. and still have it active at midnight, your body never fully transitions into that deep nighttime calm. You may not feel wired, but your arteries do. So what do you do with this? First, don't start with extremes. Start with a clean cutoff time. Pick a time, say noon or 1 p.m., or at the latest early afternoon, and make that your last caffeine of the day for 2 weeks. 2 weeks, not 2 days, because your sleep system and your nervous system need time to normalize. Second, remember that decaf isn't always zero, tea isn't always low, and chocolate can be surprisingly real caffeine. Read labels like your blood pressure depends on it, because sometimes it does. Now here's the quick self-test I promised. One day, just one day, check your blood pressure before you drink a caffeinated beverage, then check it again about an hour later. Do it when you're calm, seated, and consistent. If you see a jump, you've learned something powerful about your body. Not about caffeine in general, about your response. And if you do this test in the evening and notice a rise, that's your proof. You don't need willpower, you need a new habit. And if you're thinking, okay, Dr. Whitmore, but I need something warm and comforting at night, good. You should have comfort at night. But caffeine is not comfort. It's stimulation in disguise. Swap to caffeine-free herbal teas that do not contain hidden stimulants. Warm water with lemon. Warm milk if you tolerate it. Or even just plain water in a small amount so you're not waking to urinate. The goal is a drink that supports the nighttime dip, not one that argues with it. All right, now we move to drink number 2. And this one is the classic bedtime lie. The drink that makes you sleepy and then punishes your cardiovascular system later, when you're already unconscious. Drink number 2, alcohol, the nightcap, that backfires. Drink number 2 to avoid before bed is alcohol, especially when it's used as a nightcap. And I want you to hear this clearly. I'm not here to shame anyone. For many people, that glass of wine or whiskey at night is tied to loneliness, grief, pain, stress, or simply routine. But your blood vessels don't care why you drink it. Your heart doesn't interpret it as comfort. Your physiology interprets it as a chemical event. And the timing, right before bed, is what makes it so damaging for blood pressure. Let me tell you about a man I'll call Victor, 73. He told me, "Doc, I only drink at night. I don't drink during the day. I'm responsible." And he was. In his mind, it was controlled. 1 or 2 drinks, then sleep. And he fell asleep fast. But his morning blood pressure was stubbornly high, and his pulse pressure, top number compared to bottom, was widening. He also started snoring more. His wife noticed pauses in breathing. He didn't connect it. He thought it was just age. Here's the mechanism. Alcohol is a sedative at first. It relaxes you. It can make you drowsy. But as your body metabolizes alcohol, your nervous system rebounds. Your heart rate can rise. Your sympathetic nervous system, the fight-or-flight system, can activate. Sleep gets fragmented. You spend less time in certain restorative sleep phases. And when sleep fragments, blood pressure tends to rise because your body keeps getting pulled toward wake mode. Even if you don't remember waking up, your body can still have micro-arousals that nudge pressure upward. And there's another huge issue, airway and breathing. Alcohol relaxes the muscles of the throat. So if you snore, or if you have undiagnosed sleep apnea, alcohol before bed can make it worse. And worse, sleep apnea is directly linked to higher nighttime blood pressure. Why? Because every time breathing pauses, oxygen drops, and your body panics, briefly. It releases stress chemicals to reopen the airway. That surge happens over and over, and those surges are like repeatedly revving an engine all night. The blood pressure dip disappears. In the morning, you wake up with numbers that look mysterious, but they're not mysterious anymore. Now, let's talk about the emotional trap. People drink alcohol at night because it feels like relief. They say, it takes the edge off. And it does, briefly. But then the second half of the night becomes lighter, more restless, and less restorative. So the next day you're more tired, more irritable, more anxious, and then at night you want the same relief again. That loop doesn't just affect sleep, it affects blood pressure patterns across weeks and months. Over time, for many people, alcohol can contribute to sustained hypertension, not just a temporary bump. So what's the practical fix? It's not always never drink again, although some people do best with 0. The fix is timing and honesty. If you drink, move it earlier. Give your body time to metabolize it before sleep. Make a rule. No alcohol in the last 3 to 4 hours before bedtime. And if you notice your blood pressure is higher the morning after drinking, even a little, that's your body giving you feedback. Listen to it. Also, if you snore, wake up with headaches, or feel unrefreshed, treat that as a medical clue. A sleep evaluation can change your life. Here's a powerful experiment. For 2 weeks, keep everything the same: meals, meds, exercise, but eliminate bedtime alcohol. Take consistent morning readings and, if you can, one evening reading before dinner. If the numbers settle, you have your answer. And if your sleep improves, your cravings often change too. Because sometimes people aren't craving alcohol. They're craving downshift. They're craving calm. And you can get calm without raising pressure. Now, before I reveal drink number 1, the one hiding in healthy routines, I need you to understand something. Caffeine and alcohol are obvious because they're popular. But the third drink is dangerous because people drink it for the exact reason you and I want: relaxation. It feels medicinal, it looks harmless, and it can still raise blood pressure through your kidneys and hormones in a way that mimics a disease. Ready? Drink number 1, licorice root tea and detox teas that contain it. Drink number 1 to avoid before bed if you want to avoid high blood pressure is licorice root tea and any detox, cleanse, or spice tea that contains real licorice root. And I know what you're thinking. Wait, licorice? Like candy? Yes, but not red licorice flavoring. I'm talking about real licorice root, often listed as licorice root, licorice, or the plant name on an ingredient label. It shows up in herbal blends more often than you'd expect, especially in teas marketed for digestion, soothing the throat, or balancing the body. Let me tell you about a woman I'll call Marlene, 70. She was trying to do everything right. She'd stopped coffee early, she didn't drink alcohol, she walked after dinner. And she still had rising blood pressure that didn't make sense. The only new thing in her life was a bedtime tea, something she'd been told was calming and natural. She drank it faithfully every night, sometimes 2 cups, because it helped her stomach and tasted sweet without sugar. Weeks later, her readings were higher, her ankles were a little puffy, and she felt off. She assumed it was salt or stress. It wasn't. Here's what licorice does, and this is one of the clearest examples of natural, not automatically meaning safe. Licorice contains compounds that can interfere with how your kidneys handle hormones, specifically a system that controls salt and water balance. In simple terms, licorice can make your body act like it has too much of a hormone that tells you to retain sodium and water and lose potassium. When your body retains sodium and water, your blood volume increases. More volume in the pipes means more pressure on the pipe walls. That's blood pressure. And when potassium drops, the heart and blood vessels can become more irritable. So you can get higher pressure and sometimes rhythm issues in susceptible people. And here's why bedtime is especially risky. At night, your body should be shifting into repair mode. Your kidneys are still working, your hormones are still cycling, and your cardiovascular system is trying to drop pressure. Licorice pushes in the opposite direction. It encourages retention, it can increase volume, and that can blunt the dip. So you wake up with higher numbers and you feel confused because you did everything healthy. That confusion is what makes licorice such a trap. People don't suspect the tea, they suspect themselves. Now, I want to be responsible and clear. Not every person who sips a licorice-containing tea once will develop a hypertensive crisis. But risk is not evenly distributed. If you are over 40, if you already have high blood pressure, if you have kidney disease, heart disease, fluid retention, or if you take certain medications like diuretics, you are not in the "it probably won't matter" category. You are in the "this can matter" category. And if you drink it daily, the risk rises. Daily use is the key. Bedtime daily use is the double key. So, how do you protect yourself? Step 1, check your tea ingredients like you check your medications. Look for licorice root. Look for licorice. Look for anything that suggests real licorice extract. And don't assume that because the tea is called Sleepy Night, Digestive Calm, or Detox Cleanse, that it's benign. Names are marketing, ingredients are reality. If you see licorice listed, treat it like a blood pressure active substance, because for many bodies, that's exactly what it is. Step 2, if you love that sweet taste, don't replace it with sugar at night. Replace it with safer options. Chamomile, peppermint, ginger, rooibos, warm cinnamon water if it doesn't trigger reflux. There are many choices that do not push your kidneys toward retention. And step 3. If you've been drinking licorice tea nightly and your pressure is creeping up, stop it for 2 weeks and watch what happens. Don't guess. Test. Your body will tell you. In many cases, the change is surprisingly fast. Now, I want to address something that's going to hit home for a lot of you. Many seniors are trying to avoid sleeping pills. Good. That's wise. So they reach for herbal solutions. Also wise, sometimes. But herbs can be pharmacology. Herbs can interact with your health conditions. Licorice is one of the most famous examples because it can raise pressure and alter electrolytes. If you've had unexplained high readings, swelling, muscle weakness, or new palpitations, a bedtime licorice tea habit is not a cute detail. It's a serious lead. Let me zoom out, because the deeper lesson here is bigger than 3 drinks. Your nighttime routine is not just about falling asleep. It's about what your body is doing during sleep. And the body's number 1 job at night is restoration. That restoration includes a calmer nervous system, lower heart rate, lower pressure, better oxygenation, and balanced fluid handling. Caffeine pushes the nervous system upward. Alcohol disrupts sleep architecture and breathing. Licorice pushes fluid and hormone balance toward higher pressure. 3 different roads to the same destination, waking up with higher numbers. So let's make this practical. I want to give you a simple bedtime blood pressure protection routine. You can start tonight. And it doesn't require supplements, gadgets, or perfection. First, choose a cutoff. No caffeine after early afternoon. Second, avoid alcohol close to bed. Move it earlier or skip it, especially if you snore. Third, audit your teas. Remove licorice root if you're dealing with hypertension or unexplained changes. Fourth, keep the bedroom cool and dark and the last hour calmer. Because mental stress is another drink-like trigger. It spikes the same physiology. And here's the routine most people miss. Hydration strategy. People either drink nothing at night and wake dehydrated, or they drink a big glass right before bed and wake to urinate. Both can affect sleep. The sweet spot for many people is modest hydration earlier in the evening, then taper. Because interrupted sleep from bathroom trips can also blunt the dip. And if you're on blood pressure medications, especially diuretics, talk with your clinician about timing so you're not forced into middle-of-the-night wake-ups. Now I want to circle back to you personally, because I know some of you are thinking, but I've had these drinks for years and I'm fine. Maybe. Or maybe your body has been compensating quietly. Hypertension is famous for being silent until it isn't. The better question is, are your numbers trending upward? Is your medication list getting longer? Are you feeling more tired in the morning? Do you have morning headaches? Are your ankles swelling? Those are not random. Those are signals. And your bedtime drinks are one of the few variables you can change quickly and safely to see if your body responds. Let me give you 3 replacement drinks that are usually blood pressure friendly for most people, because I don't want you to just remove comfort. I want you to replace it. Option 1, warm water or warm caffeine-free herbal tea without licorice. Option 2, warm milk, if dairy agrees with you, because it can feel soothing and doesn't stimulate the nervous system. Option 3, plain water earlier in the evening, then a small sip at bedtime if needed. The point is, you should feel relaxed without chemically forcing sleep in a way that backfires at 3 a.m. And please hear this next part with care. If you are seeing very high readings, especially if you have symptoms like chest pain, severe headache, weakness, speech changes, or shortness of breath, don't try to fix it with tea. Don't troubleshoot for a week. That's emergency territory. Get help. What we're discussing tonight is prevention, trend reversal, and avoiding common triggers. It's not a substitute for urgent care when danger signs show up. I say that because I've seen people wait too long, hoping it's just stress. Don't gamble with your brain or heart. Now, I want to do something that will make this even more actionable. I want you to imagine your blood pressure as a campfire. At night, the fire should die down. The coals should cool. Caffeine is like tossing dry twigs on it. Alcohol is like pouring a liquid that flares, then smolders unpredictably, smoking up the tent. Licorice is like quietly turning up the gas line from underneath. Different effects, same result. The fire doesn't go out. Your body doesn't rest. And if your body doesn't rest, your vessels stiffen over time. That's how risk accumulates. So here's your 2-week challenge. For the next 14 nights, don't drink these 3 things close to bed. No evening caffeine, no bedtime alcohol, no licorice root tea. Keep your routine otherwise stable. Then measure your blood pressure the right way in the morning. Rested, seated, consistent. Write it down. You're not chasing perfection, you're looking for trend. If your systolic drops even 5 to 10 points, that's huge. That's not small. That's meaningful vascular relief. And if it doesn't change, you've still ruled out major triggers. And I want to address one more subtle point. What you believe is before bed might not be what your body experiences as before bed. If you go to bed at 10 a.m., but you drink caffeine at 6 a.m., that may still be before bed for your physiology. If you drink alcohol at 9:30, that is absolutely before bed for your metabolism. If you drink licorice tea nightly, the effect isn't just immediate, it can build over days. So don't bargain with timing. Test timing. Your body is the judge. Let's do a quick recap because I want this to be simple enough to remember without notes. Drink number 3. Caffeine-containing drinks in the afternoon and evening. They can raise blood pressure directly in some people and disrupt sleep even when you think you're fine. Drink number 2. Alcohol as a nightcap. It sedates early, then fragments sleep, activates stress responses, worsens snoring and sleep apnea, and can raise nighttime pressure. Drink number 1. Licorice root tea, especially in detox blends, which can push your kidneys into retaining salt in water and losing potassium, raising blood pressure in a very real way. If you take only one thing from this video, let it be this. Bedtime is not a free zone. It's not a time when substances don't count. A bedtime is when your cardiovascular system is supposed to recover. So what you drink before bed can either protect that recovery or sabotage it. And the sabotage is often quiet. No pain, no drama, just slightly higher pressure night after night until the trend becomes your new baseline. That's why this matters so much. Now, I'd like to leave you with a calm, practical ending, because I don't want you walking away anxious. Anxiety itself can raise blood pressure. And I'm not here to spike your nervous system. I'm here to give you control. Tonight, pick one change, just one. Move caffeine earlier, or replace the nightcap, or swap that detox tea for something safer. Then build from there. The body responds beautifully to consistency, and your blood vessels, even in your 60s, 70s, and 80s, can still improve when you stop hitting them with the same triggers every night. If this helped you, stay with me. Subscribe, because I make these videos to give you clear, usable guidance that respects your intelligence and protects your health, without fear-mongering and without confusing jargon. And share this with someone you love, because these drinks are everywhere, and most people have no idea they're affecting blood pressure while they sleep. Take care of yourself tonight, and I'll see you in the next video.